Efforts are ramping up to get teachers and students vaccinated as schools open throughout California. State School Superintendent Tony Thurmond was at a school in Los Angeles earlier today where a vaccination clinic offered shots to people 12 and over. Thurmond is promoting ways that schools, students, and school staff can prepare for a safe return to classrooms. And Superintendent Thurmond joins us live now to talk more about the preparations as kids head back to campus. Thank you so much for joining us today.
Hi, Jenna. Thank you.
You know, the superintendent of Marin County's education office said that all adults in the school system will need to provide proof of vaccination or a negative COVID test to start the year. So the question some people might be asking is, why are COVID vaccinations and testing not being implemented in schools statewide?
You're correct that there is not a mandate for vaccinations, although there is one legislator from the Bay Area who's actually considering introducing legislation to bring such a mandate. In the meantime, it's becoming very common for school districts all across the state to say that individuals either have to provide a vaccine, certification or proof, and if they cannot, then they have to submit to regular COVID testing so that we can keep everyone safe as we bring our students back to school.
And speaking of students are often required to be up to date on other kinds of inoculations like measles, polio. Why not COVID-19 for those students who are eligible, who are 12 years and older?
You know, this is a new vaccine, and as people are learning about it, there would have to be a state mandate in order to make that a requirement. Our state legislature is about to convene its final session probably by mid-September, and so there's still questions. Even if we had a mandate at this time, if it got through the legislature and was signed into law, school's going to be starting for most of our school districts next week and the week that follows. And so at this point, our message has to be that anyone who can get a vaccine should get a vaccine. It is a game changer for keeping us all safe. We're seeing that the variant has a kind of strength and power unlike anything that we've seen before, and that those who are unvaccinated are those who experience the most severe consequences from COVID-19. And so we're encouraging everyone to get a vaccine. We've been reaching out and doing outreach all over the state to encourage our students and families 12 and older to get a vaccine. We'll continue to monitor the developments to see if there's a vaccine mandate and to see when the FDA will approve vaccines for those students who are younger than age 12.
And just to follow up on that point, given that this is a school situation, there are most likely going to be cases of COVID during the school year. What are the measures in place for contact tracing, for notification, if there is a student or a teacher or staff member who does end up having COVID during the school year?
You know, as you say this, we all know that there have been some Bay Area school districts that have opened already that have seen, as many as 15 cases since opening. One of the things that we're promoting is the use of rapid COVID tests. Very important, where you can get your results in 15 minutes. If someone's positive, they can safely quarantine and everyone else can stay safe at school. We've worked with the governor and the legislature to get 5 million rapid COVID tests to be available to California schools, including in the Bay Area, for free. And so we're encouraging the use of these rapid COVID tests, and in conjunction with contact tracing, we can find ways to ensure that we keep everyone safe at our schools. Of course, wearing a mask in conjunction with COVID testing, these are all the elements that we know that allow us to get our schools open so our kids can learn during in-person instruction and be safe while we're doing that.
And, with this coming year, if there is an increase in the numbers of cases, do you anticipate there might be a move to going back to some form of distance or hybrid learning?
We like to avoid being in a situation where we can't provide in-person instruction to our students. Most of our parents have said that they want it. Many of our students struggled from the lack of connection to peers and to teachers, while some students, a small number, actually did well during distance learning. We had 1 million students who started this year and they didn't have computers or access to the internet. And so for anyone who has access, and our state does give some provision for having what we call independent study, you have to have access to a working computer. You have to have access to live instruction with your teacher. And essentially anyone who's an independent study has to get permission from the school district first and has to get the same quality of education as students who are in in-person instruction. And so that is an option that's available to some families, but we know with mask wearing, COVID testing, and anyone getting a vaccine who can, we can keep our schools open for in-person instruction, just like we want to keep restaurants open and our community open and the ability to be around our loved ones. The vaccine is a game changer, and I can't say it enough to encourage anyone who can, please get a vaccine. And do your part to help keep us all safe and keeping our schools open in California.
And speaking of the vaccine, we are hearing that, perhaps in the coming year, students under 12 might become eligible for a COVID vaccine. So are there any plans in the works for how to basically get some of those younger people vaccinated? Any thoughts about playing a role and what schools can do as part of that?
Yes, every week we're going to be doing more outreach for California families about the importance of vaccines. Just yesterday, we did outreach to 400,000 households in Los Angeles. We'll be doing a similar event in the Bay Area. Great job, by the way, to everyone in the Bay Area, one of the highest utilization rates of the vaccines, but we can do more. And the more that we do will make a great deal of difference. And so we'll, as the FDA moves forward in making the vaccine available to students younger than the age of 12, we'll be doing a great deal of work to promote it and to see if we can help our families avail themselves to the use of the vaccine.
Okay, California State Superintendent Tony Thurmond, thank you so much for joining us here on The 4.
Thank you, Jan.